Hello. There are reports of another outbreak of Lassa fever, this time in Ebonyi State. Already 2 doctors and a nurse have been confirmed dead and schools closed. So there is palpable fear. Between 2015 and 2017, Lassa fever reportedly killed over 200 across 29 states in Nigeria. So are we dealing with another epidemic? How are the authorities responding to the latest report? Generally speaking, what is going on? We will be seeking answers to these and more on Nigeria Today. I am Joy Usiagu. We begin with sound bites from the Ebonyi Lassa fever case.
We have lost a doctor and a nurse. The second doctor has a comorbidity, so it has not been confirmed whether it was Lassa fever. We are also treating any affected person free because treatment is also very expensive, and the doctors have also been sensitized to have high index of suspicion because part of the problem we had was late presentation.
With me in the studio to discuss the new outbreak is the Chief Executive of the Center for Disease Control, Dr. Chikwe Ihekweazu. Dr. Ihekweazu, you're welcome to our studio and thanks for joining us.
Thank you, Joy, and it's always great to be on NTA.
And on my far left is the Chief Consultant Epidemiologist of the Federation, Dr. Godwin Ntadom. Dr. Ntadom, thanks for joining us.
Thank you. Good evening. It's my pleasure to be here.
Now, let me start with you, Dr. Ihekweazu. We heard on that soundbite the Commissioner of Health talking about the cases of Lassa fever in Ebonyi State. What is the current situation?
So the current situation is, so what triggered all of this over the weekend is a report of a few healthcare workers being infected, and sadly 3 passed away, 2 doctors and a nurse out of 5 cases. Since then we've had 3 new cases reported from the same center. Altogether, what we're seeing this year is an increase in the number of Lassa cases, Lassa fever cases over the first couple of months, couple of weeks of the year. We've had 56 suspected cases, 22 now. I think what makes the situation in Ebonyi particularly disturbing always is in healthcare workers, because healthcare workers are those providing care, and they're often also those most at risk. And often it is the most diligent healthcare workers, those that actually go over and above the call of duty, that are then exposed to these viruses. But I think the lesson in it, very early on, to bring it out, is healthcare workers are most at risk, but they can also prevent.
Yes, because I was going to ask that as healthcare workers, it is their duty to be sure of what to do and take precaution before treating patients.
Absolutely. I've been in your studios many times over the last year discussing Lassa fever. The data you actually showed just before the program was actually not completely accurate. Last year we confirmed just under 300 cases, the highest number of Lassa fever cases ever confirmed in the country. Yes, we're looking more, and our surveillance system has improved a lot. We're supporting new diagnostics across the country. But the truth is, Lassa fever is endemic in Nigeria. And the truth is, as well, no clinician, no matter how good you are, can differentiate Lassa fever from malaria based on a clinical examination of a case. So just to conclude, Joy, because this point is critical, the first thing is to be aware. Every healthcare worker must be aware that they are at risk, and therefore really focus very early on ruling out common causes or ruling them in, like malaria. Because the critical thing, if we can rule out or in malaria, and for which there's a rapid diagnostic test, very useful, very good. So if you know it's malaria, you treat as malaria. If you know it's not malaria, then you start looking for other causes. So at the moment, we're not doing those things, and therefore we're exposing ourselves to the risk of many other viruses, actually, among healthcare workers.
Now, let me go to you, Dr. Ntadem. You heard him. Now, in terms of looking at the health workers, so it means there is a need for more advocacy. They need to look into this issue, because this is not the first time we're having the outbreak of Lassa fever. We just heard of another case in Kefi. Is there a resurgence, and what should health workers do?
Like Dr. Chike has rightly said, it's endemic in the country. It's something we should be expecting. And again, there are some precautionary measures to take when you are seeing patients. You know, over time, I think the healthcare workers, they begin to get too familiar with the precautionary measures, and they feel it's not necessary. And every case should be treated as a case that could be, like he said, malaria. There are so many things that come, you know, that come with fever, that you cannot, because of that, because you are thinking of malaria, you now say any patient that comes to your table, you treat the same way. No. And it is already known. We have areas that are endemic already, that are known, where it occurs every year. Like we talk of Ebonyi, we talk of Plateau, we talk of Nasarawa. So people in these areas should take you know, extra precaution. You shouldn't just treat any patient like, oh, it's come, let me examine, because we know the way it is contacted.
So now, you know, in dealing with the resurgence, you have mentioned certain areas where we have this epidemic. What exactly is the situation in those areas that gives rise to this recurrence?
Well, if I may say, you will realize that it comes around the same season, dry season, when, you know, less food for the rats to feed on in the bush, or bushfire. Suddenly this situation will begin to drive them home. And our practices, the way we practice, where do we keep our food? How do we dispose our waste and things like that? Because these are some of the things that will draw rodents close to the house. Ideally, many of them should be in the bush, but again, when there are things attracting them to where individuals live, they move in.
So are you thinking of education in this regard?
Very important, very important.
So what are you doing in that regard?
Well, if you see all over, there are posters. The NCDC is doing also a lot on it, you know, educating people. And if you go, you see posters being placed, and radio, even radio stations in some of these states are equally promoting the awareness of the epidemic, of the situation as it is now.
So, Dr. Ihekwazu, since we're talking about advocacy now, for the benefit of our viewers, could you run through the symptoms of the disease?
So I guess what I'd like every viewer to really take home today is Lassa presents like malaria. You know, we all think we know what malaria is, but the truth is we don't. There are many causes of fevers, and Lassa presents just like malaria. So when we think about the, you know, the pictures you see online of bleeding and all of that, it's actually in a very small proportion of cases that get that far. So really, really think about this from the very beginning. In addition to the states my colleague described, this year the highest number of cases we've seen within the first 2 weeks of this year in Ondo and Edo and then Ebonyi. So really, please, when you are febrile, you have fever, go to a healthcare worker. There are things available now to test you, tell you what you have before you treat. If any doctor, and this is a very important message to Nigerians, if any doctor looks at you and prescribes a malarial treatment for you without doing a test, you as a patient you are very well placed to refuse that treatment. He is not in a position to make that diagnosis without a test. So
listening to you talk now as a professional, it is obvious that even the doctors have a challenge differentiating between malaria and Lassa fever. So who bears the brunt?
Both. You know, we've been preaching this to doctors, but you know, we're in a modern age. Patients have to feel empowered these days that the doctors are not gods. we've been provided the instruments with which to make the diagnostics. The doctors work very hard in Nigeria, and we give them a lot of credit, but they have a responsibility to use those tests that are available to them. They're not perfect, but that's an important point. The second point, just as critical, is the use of infection prevention and control measures. So things like gloves, when you're handling a patient, if a doctor comes to you without a glove, unless it's, it's not right. So that doctor needs to wear gloves, basic IPC measures. It not only protects the patient, it protects the doctor. So there are certain very simple measures that the patient can insist on when going to the
So how do we enforce that on doctors? Because I had a scenario where a doctor wanted to treat me and he wasn't wearing gloves. And I said, I believe that that is the norm for doctors. But he didn't answer me, and he went ahead to treat me without gloves.
Yeah, Joy, so I think that's where we've got our work cut out for us. We've been on air, one of our strategies around risk communication, really educating doctors, nurses, right now in Ebonyi, from next week, together with the leadership of the teaching hospital and the state epidemiologists. Throughout next week, we'll be re-educating the doctors on all these measures and making clear to them that it's not just for the patient, actually, in that situation that you described. It's actually for the doctor's own benefit as well, because the doctor doesn't know exactly what you have at that time. So he's not only placing you at risk, he's placing himself at risk. So we're really, our strategy is, one, educating healthcare professionals, but secondly, increasing the awareness of members of the public of their own responsibilities and the opportunities they have in protecting themselves.
So, Dr. Ntadam, what is the Federation doing, your unit doing, to ensure that you support this drive? Because there needs to be a synergy between all the stakeholders.
Yes, we are actually collaborating with the NCDC, working together to ensure we get a good outcome. Like he has said also, the message is clear. You see, from all the cases we've had, they are the health workers that are suffering most. One patient comes in, the doctor picks the infection, takes it home to his family, and before you know what is happening, the thing is transferred to them. So we are working together in advocacy and equally supporting in manpower, on the field, to ensure that we are able to sort out these problems and prevent it from escalating further.
All right. This is Nigeria Today on the NTA. Let's take another soundbite on a suspected case of Lassa fever from Kefi. The program continues shortly.
There is a suspected case of Lassa fever, and we have taken samples to Erua for confirmation. So we are yet to receive the confirmation.
This is Accident and Emergency Unit of Prayer Medical Center, Kefi. The unit is very busy with patients and patients' relatives, but as you can see, the place now has been deserted for fear of coming in contact with Lassa fever, as a suspected patient of Lassa fever was being admitted in this unit.
Welcome back. I'll start with you, Dr. Ntadam. From the report there, we're still looking at the issue of facility, and if you go back to the first clip we saw from Ebonyi State, we did hear them talk about the issue of facilities and that some doctors are protesting because of the state of the virology center in Ebonyi. Could you tell us quickly the state of our health facilities across the country?
Well, that could be a general challenge across the country. Like you talk of gloves. When you use gloves, you don't use the same glove, on two patients. You use on one patient and you discard it, and all this costs money really. But again, I think it's a major challenge across the country, having enough facilities to provide. You don't expect the doctor to use his own resources to provide some of these things, and I think that's where the issue goes to the.
So what are you doing to remedy the situation?
Well, for now, I think the government will look into some of these issues and find a way of resolving it, since it's been a kind of recurrent decimal every year. Ideally, since we know when it occurs and when it is happening, we should equally prepare, like it's being done now, not until they call that a case is there before we begin to move out to do something. I quite agree with you.
Okay, let me come back to you, Dr. Ihekweazu. From what we know so far, who is at most risk of being infected by this disease right now?
So, we categorize our risk of infection in 3 ways. Firstly, is the general population, and that's really people that, so the primary route of transmission of this virus is from rodents, from rats to humans. And now the most likely vehicle is foodstuff that is left uncovered at night for all sorts of reasons. And you come out in the morning, you see your food there, but you don't know that there's been some contact with rat or rat excreta. So I think our primary message to people is, please, no matter your circumstances, you will find a way of covering your food, whether you're rich or poor. Just find a way of protecting your food from exposure to rats. The second and third groups are exposure to human transmission. And there again, the 2 groups of people most at risk are firstly healthcare workers that we've spent a lot of time talking about, but the second big risk of family members. So people providing care to an ill patient who may have Lassa that is undiagnosed. So if you're a mother or father, affectionately providing care for a child or an adult, and you haven't taken the child to an adult to a hospital for a diagnosis to be made, you're also exposing yourself to risk. So that's why we keep saying now, there's a test available, go and test, find out what the person has, and then you can treat. Don't treat at home. You're not a health professional, you're not...
But how much of this can we do locally, since it's very difficult to differentiate between Lassa fever and malaria?
So the most important test is available in every healthcare center in Nigeria. Mostly free. If you go to the private sector, it costs a little bit. It's a rapid diagnostic test for malaria. So I think it's only when that test is negative that we start dealing with the challenge of diagnosing Lassa. But there we do have a challenge in Nigeria. We have, at the moment, only 3 centers where we can make that diagnosis. In Irua, the specialist hospital in Irua, in Lagos University Teaching Hospital, and in the National Reference Lab outside Gadua, run by NCDC. So one of our strategies within NCDC at the moment, supported by the Honorable Minister of Health, is to ensure that there's at least 1 diagnostic facility in every zone in Nigeria, ultimately in every state. But these are very complicated tests to do. So we want to minimize the number of people that need that test to the barest minimum. Our strategy in doing that is working with the National Malaria Elimination Program to ensure that at least we make that diagnosis malaria, yes or no. And so only for those for whom the test is negative is it then necessary to look for an alternative diagnosis.
So Dr. Ntandom, quickly, let me go back to you. What can be done at the federal level to support what they are doing? Because like we said before, it's all about those involved, the stakeholders working together.
Yeah, I wouldn't want us to begin to see, we are all at federal level. Then CDC is at federal level, and the Department of Public Health is at the national level also. So we are working together. Like he has said, trying to emphasize the need to do tests also. Like there are several other hemorrhagic diseases, not only Lassa. Ebola came into the country, it went that way. Everybody thought it was malaria until suddenly. So we will still promote tests. Malaria program is promoting tests. In fact, the awareness creation is whenever you have fever, don't think of anything light. It could end up being malaria. Of course, malaria is a disease of exclusion. When you think of malaria, it's no longer there, it's not malaria, it could be any other thing.
So here is one more question. We were able to address the problem of Ebola. Why can't we use the same strategy on this?
I think because of the way the Ebola death comes actually put everyone on guard, and people were ready to do whatever you prescribe.
Must we wait for this to get to that?
Most unfortunately, and again, like has been said, the rats over the time we have made them our good friends and neighbors. So you are not scared when you see a rat. They come, they pass, and you ignore them until you hear about Lassa. Then you begin to act. So we should see these rodents as, you know, carrier of this infection at all times, not only when we've heard of outbreak.
So generally, what will be your advice to Nigerians, especially now that the situation is palpable?
First, to the general populace, that know that Dr. Chukwu has spent time to explain that you have to cover your food, you have to be aware, be on guard all the time that any rat coming to your residence could be the rat causing Lassa. And to the health care providers, you do not take risk. It's your life, it's your family. You have to ensure that you put on all the necessary gadgets that you require to examine a patient. You don't just assume, because you may just carry it and get home and infect all your families. Like you can see, most people who die from Lassa are usually the healthcare providers. So we should equally protect ourselves.
Gentlemen, I want to thank you very much for joining us in the studio this evening. It's Nigeria Today, and I have been speaking with the Chief Executive of the Center for Disease Control, Dr. Chikwe Ihekweazu. Thank you very much.
Thank you, Jerry.
And also the Chief Consultant Epidemiologist of the Federation, Dr. Godwin Ntandon. Thank you very much.
It's my pleasure to come.
And that's it on this edition. Do join us same time tomorrow for What is Trending in Nigeria. I am Joy Usiago. Thank you very much.